Alrighty, guys, welcome back to the Iconic Podcast. This is episode 24. I'm super excited about this episode because this is the first time that we actually have a professional on the podcast, and we're going to dive into hormones, specifically testosterone. So massive shout out to Gameday Mens Health out here in Paramus, New Jersey. If you're struggling with low T, not only testosterone, but they do help out with a number of other things like Botox, etc. Come check these guys out. So Gina, welcome to the podcast.
Welcome.
So one of the first things I thought that we should dive into is what exactly is testosterone and how is it different in men and women?
Okay. So testosterone is the primary male sex hormone. I'm sure you've all heard about it.
Yeah.
So it's responsible for sexual maturation in males, but a lot of metabolic functions in your body as well.
Yeah.
Females also have testosterone, but to a much lesser degree.
Right.
And it works similarly in females as it would in men in certain aspects, like it helps maintain bone growth, but also helps with libido. And that's about it.
That's fascinating. And so you guys, one of the main things that you guys focus on is the testosterone replacement therapy.
Correct.
Can you tell us a little bit about that? So pretty much people come in, they get injected with testosterone, and they have to come in on a how often basis to get the shots.
Okay, so let's just backtrack a little bit about testosterone replacement.
Yeah.
There are many ways you can replace testosterone.
Okay.
One way would be naturally. We could talk about that at some point.
Yeah.
There are topical creams that some people use. We don't really use a lot of those here because the delivery system can be a little bit inconsistent.
Okay.
Years ago, I think when testosterone replacement became more mainstream, that was the first thing you would see because it was the easiest thing to do. Just put cream on your skin. But if you're hot or you're cold or your skin is damp or moist, the absorption is going to be different. You can also potentially rub it off onto a partner or a child, which might be a little bit difficult. There's oral agents that you can take to replace testosterone. Some of the older ones were kind of fell out of favor because they caused some liver issues. And there wasn't a lot of available hormone once it went through your GI tract. So there is a newer one that shows a lot more promise. It's not metabolized the same. But this is predominantly an injection clinic. That's when we got to injections. So injection is going to be a guaranteed delivery. It's usually weekly. It takes about that long for it to be processed through your body before it starts to drop off again. There are certain situations that we can talk about where we might change that, like to twice weekly or 3 times a week even. And then finally, there's pellet therapy, which we're not offering here, but eventually will. That's a little bit different. That's a procedure where we put pellets of testosterone under the skin into like a fat layer on your low back or your buttock. And that you only need to get done like every 3 or 4 months.
That would be like similar to like a woman on birth control with not an IUD, but what they have like on their arm.
The Norplant kind of thing.
The implant thing, so it's like similar to that.
It's a little bit different, but the same theory that you don't need to do something every day or every week.
Right.
You know?
It just releases the hormone for you naturally.
It has its own set of side effects too that if you were interested, we could talk about.
Interesting.
We were talking about this yesterday. Kind of just getting into the testosterone conversation. Where does testosterone come from? Like, where are we synthesizing it? Like, where are you getting like the actual liquid that are injecting in our body?
So in your body, your testes make testosterone.
Right.
Okay. Some of it's made in your adrenal glands too, but the majority of it in men is made in their testes.
Right.
And that gets that happens after you receive a signal from your brain that you need more of it.
Right.
That's like a feedback mechanism from the pituitary and hypothalamus in the brain to the testes, and it's a feedback loop. What we use here is, so I think one of the questions was, is it bioidentical or synthetic?
Right.
So testosterone cypionate kind of it meets both, okay? Because what the active form that it's broken down to in your body is bioidentical. It's sourced from plants though, and plant sterols. So I think it's yams in particular, actually. A certain type of yam.
I think I was looking into.
Really?
So those are plant sterols, but if you go back to organic chemistry, and anybody took it.
I wasn't that good at chemistry, so I can't. You're gonna lose me.
Basically, testosterone cypionate is the bioidentical testosterone, but they add an ester to it so that it breaks down more slowly in your body. So you don't, if you put plain testosterone into your body without that, you would use it up very quickly. That just makes it last a little bit longer.
And you said that it's sourced from yams.
It's made in a lab.
Now, question. I know you just briefly mentioned a second ago that there are natural ways to increase testosterone.
Yeah.
Are there specific foods that could increase your testosterone? Like if I ate like a yam, would that help me out?
You have to be careful. I'll tell you why. It's not great for men to have a whole soy diet because they are plant sterols.
Okay.
So sterols can be a precursor to other hormones too. There's some studies that show men who eat a tremendous amount of soy-based products can have elevated estrogens too. So you have to be really careful with that.
Maybe that's where they got the phrase, like, and being a little improper here, but like the soy boy.
You're right.
Like, the soy boy like insult, like that's where it's like, oh, he's a soy boy, and it's we're just rephrasing that. If you eat too much soy, your estrogen goes up. You have more feminine characteristics.
I never heard that word. So
I'm
too old.
That's like a whole internet meme phrase. So that makes sense.
Right.
Now.
I'll have to look it up.
Essentially, I shouldn't make a yam smoothie every day to get my testosterone.
No, but there are foods. So natural ways to raise your testosterone. Let's just talk about that right now. Number one, anything that keeps you your natural weight or a thin, healthy weight is going to be beneficial to you.
Right.
Because first of all, fat is pro-inflammatory. If you're overweight, you have a lot of inflammation in your body.
Yeah.
Fat also makes estrogen. So if you're overweight, you're going to make more estrogen.
Oh, interesting.
So maintaining an ideal body weight, number one. Eating well and clean, absolutely.
Right.
There's like a mix of studies. There's some that show some of the ones that we use for like prostate health, like fenugreek supplements, and what's the other one? Saw palmetto. All of those that work for prostate health can sometimes help with testosterone.
Right.
And then there's some studies that show that's not necessarily true. But anything that's highly processed, you have to watch out for.
Okay.
Anything that has a lot of salt and preservatives and things like that, and especially the packaging with those types of items, because there are studies
like frozen
that
foods,
totally support the phthalates that are in the packaging.
Really?
Lower testosterone.
So the packaging itself
can be very bad for your testosterone levels.
Wow.
Yes. Like there's more studies to come.
Yeah.
Because
Right.
if you think about it, I mean, I would say for as much as we feel like it's a misogynistic world,
Right.
we really studied female hormones a lot.
Right.
Okay.
I think really recognizing and looking at andropause instead of menopause is a newer concept. It just hasn't been addressed as much.
Is there is it something that, is it more of an age thing, or even younger people can need it?
So your testosterone will drop over time.
Right.
Two different studies. One says it peaks around 18, which makes sense.
Right.
Because you need sexual maturation, and then it's responsible for all your secondary sexual characteristics, hair pattern, hair growth, muscle growth, all of that. It drops off naturally after the age of 30, usually about 1 to 2% a year. And there's another study that says about 10% a decade after 40.
Mm-hmm. Okay.
That being said, that's when you'll see the lower testosterone numbers. We do have young guys that come in with low testosterone. Right. We can talk a little bit about that too. A lot of I can remember when I was in high school, which was Jurassic, long time ago, guys doing steroids, doing excessive amounts of steroids. And that, as I explained to you, you have that feedback mechanism. It just destroys your feedback mechanism. So we do have young guys, and that can be a really challenging person to treat because they've messed up that whole feedback loop and all that whole mechanism. And you can have low testosterone from that. It doesn't bounce back.
So I was going to say, just in the same vein of things, so let's just say I went on TRT. Mm-hmm. I started receiving the shots coming in. You said it was weekly, right? Mm-hmm. Weekly, they do the shots. Following the treatment, like let's just say I decided to get off the testosterone replacement therapy, will that inhibit the future rate of which I get my testosterone?
So testosterone therapy is not going to change how you, like your ability to make, you're going to process testosterone naturally.
Okay.
Yeah.
However, you do have to keep in mind if you're younger and you're going on testosterone replacement therapy, there's not an end point to it, because if you're requiring testosterone replacement therapy, it means your body's not making enough.
No.
Got it.
So say you're an optimal physical specimen and you eat well and your weight is good and you exercise. So exercise is another one you mentioned.
That's
so
important,
exercise and weight resistance training, anything like that's going to help boost testosterone. And you're doing all of that. If we take your testosterone away,
Right.
and it was low to begin with, that's not going to change. If, say, you were super overweight and you weren't taking your care of yourself and you went on testosterone and then you lost 30 pounds and you became more active, well then, yes, absolutely. If you came off of testosterone, then your potential ability to make testosterone is better because you're healthier.
Got it.
But with younger people, we have to be super cautious about that. So there are medications or peptides that we sometimes give along with testosterone that preserve fertility. Like we want to preserve your fertility because testosterone does it lessens your fertility while you're on it.
Really? So
correct.
That explains a lot. Like bodybuilders, right, that are on high dose of testosterone have to come off when they want to start creating a family because, to your point, the fertility aspect of it is a key point. So, and kind of to Nick's point earlier, so as a young person, right, if I'm perfectly healthy, I have good testosterone levels, and it's going to sound really stupid, but if I were to come in here and just want to start getting on it, would you allow me, or is there like a benchmark where it's like, no, you're fine, or if I consent to it, like, would you let me go on more testosterone?
I would be very cautious on anyone I'm always cautious on anyone less than 40, because at 40, I know you're getting your drop off.
Right.
And I know the reason why. It's age related, and something called cell senescence, where your cells just don't function as well as they did when you were younger. But if you're young and you're in childbearing age, I have to really consider that. And you have to do your due diligence as a guy too.
Of course.
You have to wonder why if you're doing everything right is your testosterone low.
Right.
I definitely think some of it is sedentary lifestyle too. We don't get up and work farms anymore. I think we live in a very congested, polluted area, which I'm sure has something to do with it. We also have laptops on our laps and phones to our ear 24/7.
Yep.
So I'm sure I think there's some weaker studies that support that, but I think as more studies go on, you'll see that. Anybody that comes to me and I would potentially have you see an endocrinologist first, somebody that really specializes in sexual health.
Okay.
Just to make sure there's not something else going on. Because there are genetic issues that can also cause low testosterone.
Yeah.
One of them's very obvious, is something called Klinefelter syndrome, but you would know if you had that.
Of course.
What exactly is that?
Klinefelter syndrome is, how men have an X chromosome and a Y chromosome?
Yes.
Klinefelter men have XXY.
Oh, wow. So they have an extra female chromosome.
They have an extra female chromosome. So that's one thing, but you know that usually at birth, that's diagnosed.
Right.
But there are other conditions, something called hemochromatosis, which is a way your body stores iron that you may not know till later in life.
Right.
And that can affect testosterone too. So with young men, I will ordinarily want them to see an endocrinologist first to make sure there's nothing else going on.
Right.
Some endocrinologists don't manage this though. They don't want to do this. Right. So that I don't have a problem with. But out of the gate, the first thing I'm thinking is you have to understand this may be something you need to do for life. It may be.
Right.
If you're looking to have children, I'm going to want you on something that protects your fertility.
Yeah.
If for some reason you want to come off of it at some point, slow. We put you on things that help you make your own sex hormones, things like peptides or some places will use growth hormone and things like that. I kind of prefer the peptides over that. Yeah. There's also a medication, as you mentioned, enclomiphene, which is also like clomiphene, which is Clomid. A lot of people hear about that with female fertility. Yep. That helps you release the hormones that help you make your own testosterone. So if you can kind of use those in conjunction with coming off of testosterone very slowly, then you don't have the big drop off.
Okay.
We do get people that come in here sometimes, and I think I can see them when they come through the door. They've gone someplace else. They don't like it there, or something happened and they stopped going, and they don't taper off of testosterone, and they come here and they feel terrible because they went from being replaced to nothing and their body hasn't had a chance to get back to making it.
Wow.
Going into that, right, and two things. Obviously, so two things I want to address here. I noticed there was a study done recently, well, I could say something came out like a couple years back where they've noticed that the natural testosterone levels of people have decreased in men up to like 40% compared to like the 1960s, 50s, around that era. Do you think all the processed foods, to your point, the sedentary lifestyle, like the technology, is that a big component, obviously?
I definitely think that's the one thing I mentioned. Like, we're not getting up and working a farm anymore. Yep. That's just not happening. And we're not eating the food we grow.
Right. So everything we're eating, all that's kind of bringing it down.
Yeah.
The one thing I'm always curious about, how detriment is, for example, alcohol to testosterone?
Alcohol is pro-inflammatory. Like, I always use that word because anything that's going to cause inflammation in your body is going to mess with your hormones. If anything that stresses you, like stress management is super important too, because stress, your body releases cortisol. Right. Cortisol is a hormone disruptor, male or female.
What about something like marijuana, being that now it's legal in New Jersey, and it seems to me like a lot of people are smoking it. There's like lines out the doors of these places. Like, can that also affect your
I'm not
testosterone?
familiar with like any of the studies with marijuana.
Okay.
There's going to be some, obviously, because it's legalized.
Yeah,
now.
exactly.
Of course,
exactly.
And I mean, I don't think I'm talking out of turn when I say people who use a lot of marijuana generally don't have a lot of interest, and they lose interest, they lose libido. Like, I'm sure that there's a correlation.
There's
just
correlation,
might not be aware
right?
of it
Interesting.
yet.
Yeah, because obviously your mindset from weed is like to relax you and have you relax. So it's
it's definitely killing you.
It's so interesting from a testosterone perspective too, right? Low testosterone, we're talking about down like the negative impacts on that. How does that correlate with like the other aspects of life, like your dopamine levels, your serotonin levels?
Okay.
Are those completely correlated?
They are correlated. So if your testosterone is, I would say, optimized,
right?
Because there are numbers that are ascribed to testosterone of what's normal and what's not. They're individualized per person and per age group. Like there's not one set number. We have guides that we use. We can talk about those if you wanted to. But definitely, like, optimized testosterone is correlated with releasing serotonin and dopamine, so the feel-good chemicals. That's why your mood is better when your testosterone is optimized. Your bone health, your ability to lose weight, your ability to build muscle, libido, all of that.
Got it. Okay. And this is gonna sound so stupid, but going into more of that, right? Like, obviously, you come in here in the clinic, you don't feel right. You come here, you get addressed the whole scenario. I'm assuming then, to your point, this is a commitment for life, essentially. If you're naturally producing low levels of testosterone.
Correct. Yeah, you have to really keep that in the back of your head that it could be something that's, because there's no end point to it. It's not like you're going to take it for 3 or 4 years and then something magically is going to change. Especially if you're someone coming here in your 40s and 50s, we know it's going to go down.
Yeah,
at that point,
you're in a pathway, right?
But as I mentioned, there are that cohort of people who they're just not healthy in general. Yeah. So if you replace testosterone and they get healthy, then absolutely their own natural production may be better, once they come off of it, if they decide to taper off of it.
So somebody like myself, right, who's just natural, normal person, work out, do all the right things right now, you wouldn't recommend a place like this at my age. I
think it's not bad to get a screening if you have symptoms. Like the biggest, if you feel spectacular, and you eat great and you exercise and you have a great libido and a great sex life, why would you check your testosterone unless you want to pat yourself on the back?
Hey, look at my level. I feel awesome. Right.
You go home and tell your girlfriend.
That's funny. I like that.
Look at my number.
Now we were talking to Tony brought up a good point about this is like a lifelong commitment.
Yeah.
Is TRT something that would be like covered by insurance, or is that more something that you got to pay out of pocket for?
Okay, so if you're trying to get testosterone replacement covered through insurance, there's a couple caveats. They want you in an older age group, obviously.
Makes sense,
and they usually have a criteria of 2 early morning testosterone levels less than 300.
Oh,
okay. That's what they want to see before they'll even consider covering it through insurance.
Really?
Yeah.
Interesting.
So that's really a low level for your age.
Yeah.
So think about that. It would probably be very hard not everybody would come in here, and even I, with having symptoms of low testosterone, be that low.
Right.
So, and the American Urological Association kind of considers a normal testosterone being 300 and 700. I think those
I was going to ask what the normal levels are for that.
But so traditional medicine, like the American Medical Association, they still use that 300 number usually to be able to get it covered by insurance. That's it. Because we all know insurance doesn't want to pay for anything.
No. Exactly. That's true.
But like Gameday clinicians and the physicians who founded this, this is a longevity medicine practice. This is functional medicine, sexual health medicine. So the target is, like, I call it a guide, is anything less than 600 really deserves a conversation about low testosterone.
Less than 600?
Less than 600 deserves a conversation about that.
Yeah, because most men, and that's the average, like when you average everybody youth through age, like that's the average. Okay. Most men feel best when their testosterone is at least 600. That being said, if your testosterone's 470 and you feel spectacular and you're in great shape, it's good for you.
Okay.
Do
you ever, I know you briefly touched on this before, but do you frequently get young people like younger than 25 that have like super low testosterone?
I would not say lower than 25, but we definitely get people in their late 20s. Right. And some of them, you can look at them and look at their lifestyle and why they're low. Yeah. And some of them no. Like that's why I said I think there's some of them are really pictures of health and they have low testosterone. That's why I think we're going to find out more and more about environmental influences and lifestyle that we think we live a healthy lifestyle, but it's very different.
Oh my God, yeah.
And I think something else you have to think about. You mentioned how they measured today's men against the past. I also don't think it was checked as much in the past. Like we just have a lot more data now than we ever had years ago because we weren't checking it routinely.
No, we weren't. Yeah, no one's.
If I asked my father, God rest his soul, what's your testosterone? He'd be like, what's testosterone?
Yeah, they weren't looking into it.
Looking into that though, right? Obviously, the benchmarkers here. What is the way it's measured? It's nanoliters, right? Like when we talk about like 300 to 700, we're talking about
nanograms per deciliter.
Nanograms per deciliters. Does that always correlate? Like for example, if I feel terrible, but I have a 700, nanogram liter level of testosterone, is that going to completely correlate with the way I always feel? Like for example, if I start doing the healthy things, like getting more sleep, getting more, eating healthier, getting
maybe
more
like cutting out alcohol,
lean body mass, cutting out like really bad like alcohol, desserts, and all that, would it significantly go up? Like if let's just say I came in here, I was at 400, and we're like, let's just wait a bit. Like I'm overweight, I'm obese. You're like, hey, go eat first, lose some pounds. Would that dramatically increase my testosterone? You feel like?
I wouldn't say dramatically, but I think if you checked it with a decent amount of time in between, like a 6-month mark versus a 6-week, like when we adjust medications.
Of course.
You could see it that way. We see that with people that we don't put on testosterone, but we put on peptides or say in clomiphene. Like they don't have markedly low testosterone, so instead of going on replacement, because don't forget, if we do replacement, we're overriding your ability to make it. So if we give you something that helps you make your own, you can see a difference. You can see somebody go from 500 to 700 in a couple of months. So this is a screen. Like this gives you your total testosterone.
Right.
So when you look at testosterone, though, there is like protein-bound testosterone in your body and free testosterone.
Yep.
Okay.
There's two different ones, and I mean they're both important and they both function in your body, but you can have a very high total testosterone, but the active amount is not that high. So that's why if we screen and it's normal, and you want to get a little more detail, then we can send blood out and have that fractionated and figured out.
Right.
That's another thing to think about.
Okay.
And when we're looking at, you can have like a lower total, but your free amount is very active.
Yeah.
So it is higher,
From that perspective as well, when we look at testosterone, how correlated is that with like a BMI, for example? Like if I looked at my BMI, I think I get mine measured with my scale. It tells me like, let's just say mine's like 29, assuming. Yeah. Does that also correlate with like, a certain range?
Weight is always is more than likely going to have you not at your optimal level.
Okay.
Being overweight.
Being overweight, right. And then
for all the reasons I mentioned, just it's pro-inflammatory. Okay. You're going to make more estrogen. So it's counterintuitive. And that's another thing I'm talking about you have to be really careful with that too, because when we give you testosterone, your body naturally takes some of your testosterone and makes estrogen with it, which it's important for you.
Yeah, it's a balance.
It's good for your bone health. Like that's what you need it for. So, when we give you exogenous testosterone, like give you injections, your body sometimes doesn't know what to make with it at first, and you can make a lot of estrogen from it. So we have to monitor you for that.
Holy cow!
Yeah, so that's one of the things you have to be careful of. When you're taking it, that's something that can definitely happen.
Really?
So there's ways to fix that. Like if the level goes way too high, then I know your estrogen's going to be high too. They almost correlate when you're looking at it. Some people need an estrogen blocker for a period of time, just so that your body doesn't conjugate it into estrogen like in really high amounts, which will give you breast tenderness, breast swelling, make you moody, all these famous girl things that we talk about. It can happen to you too. So we just keep an eye on that.
Oh,
there's a phrase. Well,
you're giving me all the soy boy. You're giving me all the phrases.
No, I'm not gonna say the phrase, but like for example, gyno.
Okay.
I've noticed correlates a lot with that as well, right? Like where you could have like very developed pecs, and you see this a lot with like bodybuilders. They look great, great full chest, and then like they come off and they get like the puffiness around the nipples. Like, that's also direct correlation.
The problem with bodybuilding, and I have friends who are like professional bodybuilders, so I have no problem with it. But if you're doing a lot of testosterone without medical management, you're gonna get a lot of those side effects. Like if you're not looking to see what your estrogen level is, If you really don't care that you have testicular atrophy because you look great in the Speedo and your exercise, like there's all these things that we monitor for that if you're doing it in anabolic doses to build muscle, and doing it indiscriminately, there's going to be a lot of those potential side effects. And the problem is once you get gynecomastia, you have to have surgery.
You have to have surgery, right?
Yeah, there's no way to correct the hormones and have that go away.
Really?
Yeah.
Yeah, no, that's not that it's my biggest fear, but I know like over time.
And some people do that naturally. Some people naturally
have
conjugate too much estrogen, or even have the genetic predisposition to having more breast tissue. And so those people, that's good to know in the beginning because they may have more issues.
Yeah.
Something else that I did want to ask you guys, without getting in any way like political, do you guys ever have like transgender people come in?
We don't serve transgender population here.
Okay, got you.
I just think it's out of the scope of practice of the doctors who founded this and their directive with this.
Got it, yeah.
But the same theory applies. Like when you're managing transgender patients, this is exactly what they use.
Exactly.
We're using,
That's what I
estrogen
thought.
blockers and testosterone. And depending on how old the child or the adult is, have they developed secondary sex characteristics yet? Like,
yes.
Yeah,
and that's a whole other podcast.
That's a whole, I was going to say, I was telling you, I was like, definitely ask it, but we got to just be careful, because we don't.
And I'm saying it like I say we don't serve that population, not because of discriminatory, it's just out of the scope of practice. That's an entire specialized way of managing hormones. Yeah.
I want to build a list with you, right? And we're going to talk about two categories here. I want to talk about some effective ways to increase our testosterone naturally.
Okay.
And then on the other hand, I want you to tell me a little bit of like the most worst things you could do for yourself to lower your testosterone over time. As us young guys, I feel like a lot of people have bad habits. Binge drinking is a big thing. Not sleeping properly, a lot of stress. There's a lot
You're
of things
absolutely right. You just named the top three. Smoking is terrible for you in general for so many reasons.
Right.
Stress. Managing because you're just busting out cortisol, tons of cortisol.
Yeah.
Not sleeping because you don't release, and even shift work. That's another thing.
Really?
If you don't have a consistent sleep schedule, and a lot of firemen and physicians are guilty of this because they do a lot of shift work, like ER doctors, things like that.
Yeah.
You need sustained sleep, sustained restorative sleep to release growth hormone, which is in turn what's going to help you make testosterone. So if you travel all over the world all the time and you're not sleeping and you're not in a normal time zone, that can impact you. Smoking is bad across the board.
Smoking's number one, you would say.
It's at the top. It's at the top. Just because
we're referring to cigarettes.
Yeah. Only because you're introducing, you're
so many chemicals in there.
You're just causing a lot of metabolic stress to your body. You're not getting enough oxygen. There's all sorts of things that you're doing.
That's an eye opener for me,
and your
honestly.
toxins, you're introducing toxins to your body too. So toxins in general are hormone disruptors. So being an ideal weight, again, number one, that's also extremely important.
Be aligned with your BMI, right?
Staying active, especially if not just aerobic activity.
Yeah.
Weight training, resistance training too.
Yep.
Yeah.
Getting sunshine. I hate to say it, we talked about nutrition. Yes,
Vitamin D.
Clean foods, but vitamin D is also correlated. Low vitamin D is also correlated with low testosterone.
I'm screwed, because I don't.
None of us get it. I'll tell you, I've been in healthcare now since I was 15. That's all I've ever done.
Really?
Yeah. So we never checked vitamin D levels 25 years ago. Never. It wasn't even on the panel. And now you do, and you can see that low vitamin D is correlated with so many things. Plus, we're constantly told to stay out of the sun.
Yeah.
And that's the best way your body can make vitamin D.
Vitamin
So
D,
we supplement it. We supplement it orally, which is not as effective. So
Gina, that really hits home with me because I would say 2-3 years ago, I was overwhelmed with stress from work. At that point I was getting really bad anxiety. I wasn't working out. I let go of the gym. I was eating like crap. I was drinking a lot. So I wasn't sleeping on weekends. I was only thinking about work. And I've noticed to those 3 habits you mentioned, we were talking about throughout this entire conversation, I quit alcohol for 100 days. I started walking every day, and it's my lifelong habit now. 10,000 steps every single day.
That's impressive.
Hitting the gym. Yeah, no, I live on a Fitbit. This thing never comes off. Hitting the gym consistently, and I notice now, my anxiety doesn't exist. Even when I do drink and, Like obviously there's this thing called anxiety the next day. You feel freaking awful. You're just all jittery. Like even that's not like a life-changing thing. So I agree with what you say, because that was my go-to. I looked up my symptoms. My vitamin D level was really, really low. I noticed just going outside, getting walks, eating healthier, completely changed my life. So I almost feel like the testosterone aspect of it, I probably was eating myself alive at that point.
And you never checked it then.
And I never checked it. And then you know what's interesting though? When I did check it, I was in the low 4s.
Okay.
Yeah, so who knows what it is now? I mean, I feel great now, so if it's still the same.
Speaking of which, the results actually are ready.
So before we do that,
yeah.
one other thing I want to talk about too. So a lot of the times the biggest complaint when guys come in here is fatigue, like mental fatigue and physical fatigue.
Yep. Yeah.
That's why they want their testosterone checked. So the only thing I recommend too is before you head for testosterone, especially if you're younger, you have to do your due diligence about other things. Are you diabetic?
Right.
Is your blood pressure too high? Is your blood pressure too low?
Right.
Okay.
Are you anemic?
Okay.
Is your thyroid off? Like those, you want to make sure you have a relationship with a primary care doctor to address those things too.
Of course.
Because testosterone is one component, but those are kind of the basic before you even start looking at the other things.
Got it.
And to wrap that up, I just want to get your list also, like your top 3 on the other hand, because I know I spoke a little bit about it, but I want to hear from you.
So top 3 about
like best ways to
increase testosterone.
Yeah.
Stay optimal weight. Stay active.
Okay.
Eat clean.
Eat clean.
That's top 3 I'm thinking. And then also, I mean, testosterone also, you get a testosterone surge with sex, so stay active.
Stay active. Go out, get the ladies.
Yeah.
This might be a stupid question. You just mentioned maintaining optimal weight. Can someone like me that's very skinny, can that also be bad for your testosterone? Like indicate that you have low testosterone?
Only if you're malnourished. Like some people just have a very high metabolism.
Okay.
As long as you have lean muscle mass and you're active, you're gonna.
Okay, interesting.
And before we get into the results, I gotta ask this. I know we were talking a little about yams, but is there any specific food group you could recommend that's like naturally enhancing?
As far as I know, the studies that most support like particular ingredients in foods that can help. Anything that contains zinc, selenium, so like top of the line of that I think is like seafood, like shellfish, oysters, things like that.
Yeah, don't they say like oysters are like a natural aphrodisiac?
There's a reason why.
Too?
I'm sure that was probably an old wives' tale from whenever, but the reality is zinc is definitely correlated. Like zinc supplementation. You're gonna get into me
a lot of trouble, Gina, because my girlfriend loves oysters. So we gotta keep your testosterone up now. Damn. All right, well, that's good to know.
Actually, we get the
results out. Get the results. I'm scared. It's like when like.
So do I have the? Can I?
I
have to ask because in any other world this is a HIPAA violation. So I just want to make sure.
Read the results.
Okay. All right. So Nick. So this is an early morning screening. It's 3:11, so it's a little on the low side. But as I said, that can also be. It can fluctuate if you're not sleeping well. If you've been sick, there's a lot of reasons why it could be low.
Okay.
That's why, like, say you came in and this was it. I would not jump to put you on testosterone. Let's find out why it's low. Let's make sure it's low. Do a more thorough evaluation.
This guy doesn't sleep. So.
I don't sleep, and honestly, I have been abusing the alcohol lately too.
Okay. So pro-inflammatory stuff, all those reasons. Are you eating well? Because usually when you're drinking a lot, you don't tend to eat that. It's wings and fries.
Exactly right. Honestly, not. I can't say that it's been a clean diet lately.
Yeah. Okay. So, but as I said, this is one number. I wouldn't jump to put you on testosterone. I probably would have you do a comprehensive panel so we could look at everything else, which would also include like thyroid. It would look at the free testosterone. It would look at all the hormones that are released from your brain to stimulate testosterone production.
Right.
So like that's something we can do here as well. Anthony, 664.8.
Okay, sweet.
Yeah, so
you're up there.
I've been hitting the gym recently. That's why.
That's a good number.
And again, these are just screenings. This is total testosterone. And as I said, it can fluctuate, but it's the morning. So obviously this is when it's highest in the morning.
Yeah. You know what's interesting though? I do got to say, I'm not surprised with like some of like the variances here, because like I said, a couple years back, binge drink like no tomorrow and like no sleep, no nothing. And so I'm not surprised. Wow, that's kind of crazy.
I know.
411, like I think it was like around the 4s, like a couple years back. And I knew it wasn't like optimal at the time because I wasn't doing anything good for myself. So damn, all right, good stuff.
That's awesome, dude. That's definitely an eye opener. I got to do some lifestyle changes for sure.
Well, did you say he travels a lot too?
He travels a lot, doesn't sleep. We like to have a couple of cocktails, and it's
when you're younger, you're invincible. Like I have young children.
Great.
You guys, you don't think anything could ever go wrong. So
Yep, that's very, very true. That's super true.
No, so that's really cool. So looking at this, right? I feel like we're two sides of the coin. what would you recommend? Like, for example, somebody like myself, I have that testosterone, clearly don't need it right now. Now, assuming, right, I start experiencing other things, let's just say male, hair loss. Is that more of a genetic thing, or is that a testosterone thing? Like,
it's genetic, but testosterone plays a part. Because once again, just like you can conjugate estrogens from your testosterone, there are different types of testosterone too. There's one that's super, super potent. It's called DHT. Your body can make that, and that's kind of correlated with acne and hair loss and things like that. Yeah. So you can have that genetically, or also when we're replacing it, it's something we watch for.
Got it. And apart from that then, so if I experience male pattern baldness and my testosterone's good, it's just a natural thing. So more testosterone isn't going to help my hair grow back.
No, absolutely not. That's a.
I would love to hear that. Yeah, I have to ask those questions. People, people see the correlation sometimes and they think.
No, you're right. That's a good question.
If you ever want to do another podcast on hair, we can do that, because I feel like
oh my God,
that's also at the top of the list for men. We were just talking about this off mic.
Yeah, like hair, building muscle, I know is a big thing, and then of course,
and just what's become available years ago now with hair replacement. I mean, there's a lot of studies that show you guys should be taking minoxidil every day now.
Really?
Oral minoxidil.
I always get worried about that. So I've heard of this company called Hims. I'm not sure what you would recommend in terms of like hair, to ensure hair's still thick and you don't recede. Because I know it's around this time once you really start experiencing all those aspects
the
of
big
it.
The big change.
Would it be similar to like putting a dependency on it? Like, I feel like if you use like what was it,
minoxidil?
Minoxidil, apparently, like it'll help maintain it. But then it's like if you get off it, your hair can like
all
regress.
Minoxidil does is bring oxygen to your hair follicle. That's all it does. That's all it does. And it was just a side effect of a blood pressure medication. Like in high doses, it lowers your blood pressure. In low doses, it still does the same thing. So there's really not a dependence on it. When you first use minoxidil, you will notice hair loss, but that's not. That's because the hair that was going to fall out anyway is just coming out quicker.
Right.
And then you start to grow hair from minoxidil.
So the only thing I want to get into, and I feel like this is also a big craze in men, right? People are worried about libido sizes or libido performance. Does testosterone also correlate with like the size of the libido or like the, that aspect of it? Like
it's one factor. Like that is one thing I do tell some, not necessarily in your age group, some older gentlemen. If they think replacing testosterone is going to fix their libido and erectile dysfunction issues, that's not a guarantee, because it's only really one component of libido, one component of erectile dysfunction.
Right.
So yes, optimizing it can certainly help.
Sure.
But it's not the be all end all of that. But yes, it's definitely correlated with, like, if your testosterone is markedly low, it would be very common for you to have a very low sex drive.
Really?
Yeah.
Okay, that makes sense.
Yeah.
They're correlated.
And that doesn't correlate at all with size, right? Like the size of the libido.
No, that's another thing too.
Yeah, I'm not sure. I feel like it's a very common misconception.
Yeah, it is a misconception. Yeah, it is. Once again, that's a whole other podcast.
Might have to come back to a part 2.
No. I feel like we were talking a lot on the men's side and improving overall health. For example, is there a scenario in a woman, right? Does it work like a flip of a coin? Like, can a woman get too much testosterone naturally? No, right? Like, how we're worried about our estrogen.
Once again, there's genetic issues that can cause that, genetic things. But women make testosterone the same way. They're making it in their adrenals. They make it, but they make some in the peripheral tissues too. Our numbers are much, much lower.
Right.
And ours drop off over time too. Like once we hit menopausal age, they drop off even more.
Yeah.
So years ago too, hormone replacement was focused for women, mainly on estrogen and progesterone, because those were our big hormones. Those are the ones we're looking at. But then they discovered, testosterone for women helps with bone health, helps with red blood cell production, just like it does in men.
Yeah.
And it also helps with libido, women's libido.
Yeah.
So a lot of people who do hormone replacement for women now, like pellets in particular, they've discovered that adding some testosterone to menopausal women helps tremendously with libido.
Right. Really?
Right.
Yeah. So we it's addressed in women now too. Yeah.
I was gonna say that's something that always stood out to me, like a woman's libido as well. It's what correlates with that? Is that also a hormonal thing where maybe they're not as engaging? And to your point, over time I noticed that could be a thing and a trend, but where people aren't as women specifically aren't as sexually active. Is that a complete correlation with that? Like,
I think
Is it
testosterone
estrogen?
again is one of the
Yeah.
components, but I mean, once again, this is like a 2-hour podcast.
Right.
It's actually very interesting if you study hormones and
Yeah.
like what draws people together physically and sexually in the beginning and what evolves over time.
Right.
It has nothing to do with someone not finding you attractive anymore. It's just how our hormones work.
Really?
You know,
Okay.
like
Interesting.
like the thing that draws you in starts to drop off, and then you release oxytocin, which is that bonding hormone, which is the
Right.
hormone that women bond with their children, but men and women release it too.
Yeah.
So it just has to do with our amazing bodies. It has nothing to do with, oh my God, she doesn't want to have sex as much, she's not interested in me anymore. That's
Right.
really not it. And I think men, because you're so largely testosterone driven,
Of course.
women, it's much more subtle. You see these things, you never know with a woman. Guys, it's pretty obvious. Like all of a sudden, my husband's not crawling all over me anymore. He's been doing it forever. Like something's wrong. You don't really have that flip with a woman. It's a little bit different.
It's a little bit different.
But yeah, so as I said, that's a whole other podcast, and it is
Yeah.
really interesting about how hormones change over time
Yeah.
when you're in relationships, when you're in close relationships.
Yeah, yeah. And
That's
I said,
fascinating.
We gotta definitely save that conversation for another time, because obviously you hear the trends of like sexless marriages, or hey, I'm with my partner for like 3-4 years and now like we're still young, and like it's like, oh, like now we're not interacting as much, we're not going that route. So I think that's always something that always stood out to me. I wanted to see if it had any correlation with the same thing.
But women too, like
Yeah.
we have to do our due diligence too. Why am I not interested?
Right.
You know, it's worth making sure I'm optimal weight, I'm eating well, I'm
Yeah.
exercising too.
Yeah.
It's going to affect me the same way as you, just with
Yeah.
a different group of hormones.
That's so interesting. No, I feel like today we got a lot. I
agree. I think this is like the most insightful podcast we had.
literally, because now I'm like, and for the viewers today, it's like one thing I know now is like, let me just make sure I lock in on my sleep. Let me make sure. You kept saying a word, inflammatory.
Pro-inflammatory. All the things.
Anything.
Think about all the things we do that are pro-inflammatory.
Yeah. And,
Yeah.
And let me ask you this also, as we're wrapping this up and kind of getting the whole summary here. What food would you not recommend? Like, I know you mentioned smoking kills you as well. It's really bad.
Anything processed,
Anything
highly
processed.
processed
So no
foods.
McDonald's.
That's the biggest one. I
Yeah.
mean, the 80-20 rule to me is a good way of looking at things. I
Okay.
feel like I have a friend. His name's Peter Kofitsis. He's actually a speaker, a health speaker, and he lives by an 80-20 rule, and he's in perfect shape, and he's in his 50s. It's
Yeah.
basically, I eat really well and do everything right 80% of the time.
Yeah, yeah.
You know what I mean?
Yes,
So that
yes.
you can have your weekend where you go on your
Yeah.
benders and do stupid things.
That's fair.
I think it's a more realistic way of living life, and
Of
still,
course.
I mean, God bless the people that can do it 100% of the time.
Yeah. Like
I
bodybuilders, all
cannot.
those guys. Yeah, that's just.
But bodybuilders really aren't. Like in my head, they're not,
Oh, yeah,
because
'cause they're on drugs,
they're also
yeah.
cycling it. You know what I mean? Like
yeah. That's true. That's true.
I'm making myself super restricted for 9 months, and then
It's like, yeah.
everything changes. So
Yeah.
it's just a different way of thinking, and
No, and like I said, this
and
is
they're
super-
fascinating too. Like I said, I have friends who do it,
Yeah.
and I could never do it. I sit there and I eat the McDonald's in front of them.
Maybe no. Literally, the last thing I do have for you, as we're obviously kind of coming here on the close, what is the future for testosterone therapy? Is there new technology, things going to come out? Is there a way that's really going to help us help even young individuals to enhance performance on a healthier scale where maybe there's no regression?
I think
Like,
peptides.
Peptides,
You're going to be
peptides.
hearing more and more about it, you know,
Okay.
because it's more of a, it's just a more natural way, basically just the same amino acids that are present in your body.
Right.
We can string these amino acids together in a lab,
Yeah.
and they can mimic what's happening in your body. So they can, they can help you release your own growth hormone. They can help your pituitary function better. So I'm not saying that it's the be all end all, but I just think you're going to hear a lot more about it.
Right, like be able
going
to, like,
forward.
Like something probably even over the counter at some point, right, in the future.
Yeah, I mean that's a lot of the issue with things is what is it going to be given parenterally, like in a muscle, or through the gut? Through the gut always is a different challenge
Yeah.
because of the reasons I talked about earlier.
Yeah.
But once again, peptides, there are some that are available through the belly
Yeah.
that you take by mouth, and some you can get a good blood level, some you can't. Like it just depends on what it is.
Got it. No, Gina, I'm mind blown. A lot of good things to take away from this.
Yeah, thank you very much
Thank
for
you.
your
Thank
time
you
and
so
the
much.
conversation.
No, it was an absolute honor.
Thank you
Nick,
for-
I'll let you do the close, bud.
Guys, I hope you enjoyed episode 24. Again, if you're in the North Jersey area and you're struggling with low T like myself, come on out here to Gameday Mens Health. They'll take good care of you. Gina, thank you so much. You've been awesome.
You guys are great.
No.
Thank you.
Thank you.